Hello, I'm Shawn Owens, registered nurse. I'm the Vice President of Nursing Services at Southwest Mental Health Center, and I've been a behavioral health care nurse for over 20 years. I'm so happy to be here today to talk to you about a topic that really can make a difference in the lives of every person, and that is basic strategies for suicide prevention. You've probably heard that suicide ranks as the 11th leading cause of death for all ages. The 11th, third in the young and the older. More than 32,000 suicides occur in the United States every year. That's roughly 89 a day, or one every 16 minutes. And the attempts are even greater. Among young adults aged 15 to 24 years, there's one suicide for every 100 to 200 attempts. And in older people, 65 years old and older, there's one suicide for every 4 attempts. In 2007, the CDC tells us that 14.5% of U.S. high school students reported that they had seriously considered attempting suicide during the 12 months prior to the survey. More than 6.9% reported that they had actually attempted suicide one or more times during the same period. These are grave statistics. Statistics tell us that these things increase the likelihood of suicide. History of a prior attempt, alcohol use, which reduces inhibitions and increases impulsivity, childhood trauma, age, in that teens and older adults are more at risk. Gender is a statistic. Men are more at risk than women. Sometimes people who are struggling with issues of sexual orientation are at greater risk. Anyone with a mental illness, especially those mental illnesses associated with depression, insomnia, anxiety, agitation. Also, a family history of suicide or violence increases the risk. Lack of social supports, chronic physical illness, especially chronic pain, lack of coping or self-care skills, lack of a spiritual religious belief system. And sometimes a risk factor can be unwillingness to get help because of the stigma attached to getting mental health care, or the stigma attached to getting substance abuse care, or simply feeling so hopeless that that person doesn't reach out for help. Other risk factors do include barriers to mental health treatment, such as not having a way to pay for it, or feeling like it's difficult to get, or not knowing how to get help. Also, having easy access to lethal weapons is another risk factor. Some statistics show that teenagers in a home with a gun have twice the statistical occurrence of suicide. So it's definitely something to think about if you're in a situation like that, whether it's worth taking the risk, and certainly to make sure that you take precautions to protect them. So practically speaking, what should you do? First of all, know the warning signs that someone might be thinking about suicide. I'm going to give you a long list of indications that somebody might be thinking about suicide. And you know what? You probably wouldn't see more than 1 or 2 of these in any given person. And it's not a sure thing that that person is thinking about taking their own life. However, it's just an indication that you should ask them if they're thinking about it. Sometimes it's kind of a fear that if we talk to somebody about suicide, we'll actually make it more likely that they'll act on the thought. But in fact, the opposite is true. People who are thinking about suicide may be feeling very isolated, very hopeless, very worthless. They may be feeling like the world is better off without them. When we reach out to them with hope, with dignity for them, with respect for them, with understanding of what they're going through, they receive that usually with great appreciation, and they may actually let us into what they're thinking and let us help them. So here's the warning signs. First of all, talking a lot or sharing that they are thinking about death. Even a passive death wish, like wishing that a person was not alive, wishing that they would wake up dead, is a concern because that could become active suicidal thinking. Also, clinical depression. The number 1 risk factor for suicide is untreated depression. So if someone is going through deep sadness, loss of interest, loss of the ability to have fun, trouble sleeping, a change in their appetite, and you see these symptoms worsening over time, definitely reach out to that person. If the person states having a death wish, maybe they're tempting fate by taking risks that could lead to death, such as driving fast or running red lights, not wearing their seatbelt, doing uncharacteristically risky things, losing interest in the things that a person used to care about. You know, a lot of people think of depression as sadness, but it's also almost a listlessness, a lack of energy, a lack of forward thinking, a lack of momentum. And when you see that, losing interest in the things that used to be passionately cared about, you know that's something out of the ordinary. Making comments about being hopeless, helpless, or worthless, putting affairs in order, tying up loose ends, changing a will, giving away precious belongings. That could be a very powerful sign, especially in a younger person. A teenager or a young adult might give away some of the most meaningful things in their life as they prepare for a suicide attempt. Definitely a warning sign. Sometimes saying things like, it would be better if I wasn't here, or I want out, or a sudden unexpected switch from being very sad and down to being very calm or appearing very happy. That might indicate that the person has made a firm decision to act on their suicidal thoughts. Again, talking about suicide, talking about killing oneself, visiting or calling people to say goodbye, and some things that just make us worry: legal, financial, work problems building up, seeing a person facing problems where it seems insurmountable that they could overcome them. Of course, alcohol and drug abuse, only because it certainly adds to the decrease in inhibition against the act of suicide. Purchasing a gun or stockpiling medications. If any of these occur and the person has had an attempt at suicide in the past, we would be very, very, very concerned. About half of the people who commit suicide have had a previous attempt in the past. So that would be very, very concerning. So if you know someone who appears depressed, appears to be contemplating suicide, take that person seriously. Listen to what he or she is saying. Take the initiative to ask that person, what are you planning? What are you thinking? Have you thought that you might hurt yourself or kill yourself? When they answer, if they answer yes, don't argue. Oh, don't do that. You have so much to live for. Instead, just say, tell me more about what you've been going through. Tell me about what you're feeling. Try not to argue with them, but just listen to them. Let them get it off their chest. And as you do that, you want to also make a plan with them to remove any means that could be used for self-injury. But stay calm and in control. Don't panic. Be a loving, supportive friend or family member and help that person get to help. So as you're listening and you're expressing your concern, you're not arguing with the person, you're also removing anything that could contribute to the self-harm of the person: weapons, pills, alcohol, car keys. You're going to stay with that person until you get them some help. And what are some ways that you can get them help? Of course, here at Southwest Mental Health Center, we offer telephone screening and assessments if indicated. In other words, if you call and it does sound like you have a problem, we'll say, come on in, let's let you see a counselor and a physician. And we do that for children up to age 18 years. And our telephone number to call for that is 210-616-0300. Maybe your situation's not that dire and you could just talk to somebody on the telephone. We again endorse that those suicide hotlines do help keep people safe. In San Antonio, Bexar County, you can call 210-223-SAFE. That's 210-223-7233. And of course, the National Suicide Hotline is another option at 1-800-273-TALK. That's 1-800-273-8255. You know, it's my greatest hope that this is a talk that you will never need to use the advice from. I hope that you are not in a situation where you or someone you love is thinking about suicide. But if you are, you can make a difference. You can make a difference with a friend or family member by reaching out to them. Ask them, listen to them, escort them to a place that can care for them, or get them on the phone with a suicide hotline. Bring them, if they're a child under the age of 18, to Southwest Mental Health Center and let us help you determine what's the best course of action for that child. If it's you, know that there is hope. There is help, and one of those hotlines could be just the thing that brings you back to realizing that life is definitely worth living. You can also call 911 if you're in an emergency situation where they're not necessarily cooperating with you helping them, maybe not letting you remove the means. Maybe they have a weapon or pills and they won't give those to you. You can call 911 and the police can help you get that person to an assessment. Thank you so much. I've really enjoyed my time that I've spent with you today.